If you're a man who values his health, his confidence, and his ability to truly connect with a partner, especially in the exciting world of dating older women, then this video is an absolute must-watch. We're about to dive deep into a topic often whispered about, sometimes ignored, but profoundly impactful on your overall well-being and your success in every aspect of life: your penile health. I'm Dr. Marcus Hale, a urologist and pelvic surgeon, and as the host of Dating Older Women, I'm here to tell you that taking care of yourself from head to toe is the foundation of a fulfilling life and thriving relationships. Today, we're going to uncover 10 critical mistakes you should never make when it comes to your most intimate organ. And trust me, some of these insights will genuinely surprise you. Guys, as a urologist, a significant part of my professional life revolves around ensuring men's intimate health. And quite frankly, I genuinely care about it, and you absolutely should too. In this comprehensive guide, I'm going to reveal 10 crucial practices you should be adopting for your penile health. Practices you probably haven't even considered. And make sure you stick around, because the 10th point is a real game changer, one that many men overlook entirely. 1. Don't ignore your penis. Let's start with something incredibly simple, yet profoundly overlooked. Never, ever ignore your penis. Many of you might not fully grasp this, but the way your penis functions, its overall health, serves as a powerful barometer of your entire body's well-being. Think of it as an early warning system. When we observe men who begin to experience difficulties with erections, and we track their health over the subsequent 7 years, a startling 14% of them will unfortunately go on to suffer a heart attack. This isn't just a coincidence, it's why we often refer to erectile dysfunction, ED, as the canary in the coal mine. It's not just about what's happening below the belt. It's a profound indicator of deeper systemic issues brewing within your body. I always emphasize this: strong, healthy erections and a robust sexual desire are powerful markers of your overall health. They tell us a great deal. Firstly, they signal that you have excellent blood flow throughout your body, a critical component for heart health and general vitality. Secondly, they indicate that your hormones are beautifully balanced and functioning optimally. Thirdly, your nervous system is likely in peak condition, sending the right signals at the right time. Fourthly, it suggests you're in a good psychological space, free from overwhelming stress and anxiety that can wreak havoc on your physical functions. And finally, it confirms that you aren't inadvertently introducing any substances into your body that could be detrimental to your penile health. Consider a story I often share. John, a successful 45-year-old executive, came to me complaining of intermittent ED. He dismissed it as just getting older. But after a thorough checkup, we discovered early signs of high blood pressure and elevated cholesterol, issues he hadn't noticed. His ED was the body's subtle cry for help. By addressing these underlying health problems, not only did his erections improve dramatically, but we also significantly reduced his risk of future cardiovascular events. This highlights how listening to your body, especially your penis, can be a life-saving habit. 2. Don't DIY things for your penis. This brings us directly to mistake number 2. Absolutely do not DIY things for your penis. Believe me when I say, I have truly seen it all in my years as a urologist. And I can tell you unequivocally, there is no safe, at-home remedy or concoction that will magically make your penis longer, thicker, or instantly more powerful. No matter how enticing or desperate the ads promise, these solutions are often unproven, inherently unsafe, and can cause irreparable harm. I remember seeing an utterly bizarre advertisement once. Some individual was demonstrating pouring apple cider vinegar onto their penis, claiming it caused immediate growth. My immediate reaction was, this makes absolutely no scientific sense. Yet, I understand the underlying desperation surrounding penile health. Men are often incredibly eager to find quick fixes for issues like size concerns or erectile difficulties. Unfortunately, this eagerness can lead them down dangerous paths. Let me give you some concrete, alarming examples. One common practice I see is jelqing. This involves men using their own hands, applying significant pressure to perform stretches on their penis, with the mistaken belief that it will increase penile length. The harsh reality is that when people engage in jelqing, they often cause microscopic tears and tiny fractures within the delicate penile tissues over time. This chronic injury can, and frequently does, lead to long-term erectile dysfunction. You can ask any urologist, and they will confirm. We have all encountered young men who have practiced jelqing to excess. Guys, you know how it is, right? If you're told something might help your body, you're not just going to do it half-heartedly. You're going to commit fully. And in this case, fully committed often means going too far, causing self-inflicted injuries that result in irreversible damage to your penis. So please, for the sake of your future health and function, do not do it. Another incredibly dangerous DIY trend involves men crafting their own constriction bands at home. If you've watched my previous video on proper constriction bands, I shared a harrowing story about a man who, while admittedly altered, placed a metal construction nut on his penis. By the time he came into the ER, his penis was so swollen that we had to call the fire department to use a Jaws of Life tool to remove it. I am absolutely not making this up. It was a truly terrifying ordeal. Another guy had cut a ring from a plastic soda bottle and got it inextricably stuck. These risks are simply not worth it. A proper medically designed constriction band is readily available for around $20 on Amazon. They are manufactured to be safely and easily applied and removed. Don't risk permanent damage for a misguided shortcut. 3. Keep it clean, but not too clean. The third crucial point is to maintain proper hygiene. I believe most men understand the basic premise of keeping their penis clean. However, the nuances are often missed. For men who are uncircumcised, it's easy to forget to consistently retract the foreskin, clean thoroughly underneath it, and ensure it's completely dry. Neglecting this simple step can lead to conditions like balanitis, which are painful infections of the foreskin and glands, head of the penis. This can be incredibly uncomfortable and, frankly, easily avoidable. So, make it a consistent habit. Always take the time to retract your foreskin, clean gently underneath with mild soap and water, and dry the area thoroughly. If you find that you cannot retract your foreskin, that is a significant red flag and warrants immediate medical attention. While penile cancer is exceedingly rare, there are unfortunate cases where men develop cancer on their penis, and because they were never able to retract their foreskin, they couldn't see the early warning signs. I always advise my patients, ensure you can fully retract your foreskin. If you can't, please speak to your urologist or general practitioner without delay. Sometimes the condition, phimosis, can be remedied with a specialized cream or a small device. In other cases, a circumcision might be recommended. The ultimate goal is always to be able to retract, clean, inspect, and then gently return your foreskin to its natural position. In that same vein, while cleanliness is paramount, aggressive cleaning should be avoided. I've seen men use overly scented or very strong soaps, which can actually cause irritation to the delicate skin of the penis. The skin in this area is not designed for harsh scrubbing or powerful chemicals. It needs to be clean, yes, Let warm, soapy water flow over it. Ensure there's no smegma buildup, a natural accumulation of dead skin cells and oils. But do not be aggressive. Do not wash it vigorously, and certainly don't rub it harshly, as this can lead to irritation, dryness, and potentially even micro-lacerations that open the door to infection. Gentle is the key. And remember, if you're looking for ways to enhance your confidence in all areas of life, including your hygiene routine, head over to Dating Older Women for more tips and insights that go beyond the superficial. 4. Don't ignore pain or other warning signs. Number 4 is absolutely critical. Do not, under any circumstances, ignore pain or any other warning signs emanating from your penis. If you notice a problem, any problem, with your penis, please talk to your doctor immediately. Do not brush it off. Do not hope it will simply disappear. Sometimes, a seemingly minor issue could indicate a sexually transmitted infection, STI, which requires prompt treatment to prevent further complications for yourself and your partners. Other times, it might be a urinary tract infection, UTI. If you observe blood in your urine, that's a serious symptom that could point to a kidney stone, a bladder stone, or, in more concerning cases, even cancer of the bladder. Or, if you see an ulceration, cancer of your penis. Guys, I understand this is incredibly difficult. It's challenging to walk into a doctor's office, expose your genitals, be vulnerable, explain what's happening, and often men feel a sense of judgment, particularly if they suspect an STI after unprotected sex. I completely empathize with these feelings. However, your health is simply not worth the cost of embarrassment or fear of judgment. If you feel judged by your current doctor, please find another one who makes you feel comfortable and respected. Ultimately, our primary goal as medical professionals is to ensure your safety and health. I can share some of the saddest stories from my career, and they invariably involve men who ignored persistent ulcers or lesions on their penis, only to be diagnosed with advanced penile cancer. Penile cancer is a rare but extremely aggressive disease. I've probably encountered only a handful of cases in my entire career because of its rarity. But when it strikes, it is truly terrifying and traumatic. Men often ignore these early signs because the thought of something being wrong with their penis is so profoundly scary. They don't want to face it or the potential treatments. But let me be absolutely clear. If you address these issues early, the interventions required for your penis will be far less invasive, far less life-altering than if you delay and allow the condition to progress. Early detection and treatment are paramount for the best possible outcomes. Don't let fear dictate your health decisions. 5. Stay in control and be safe. Number 5 is paramount for both pleasure and protection. Always stay in control and prioritize safety. Let's be honest, there is nothing sexier, nothing more liberating than safe sex. When you are intimate with someone and you're not burdened by worries about contracting an STI or an unplanned pregnancy, you are free to be fully uninhibited, fully vulnerable, and truly present in the moment. This is the recipe for incredibly fulfilling and passionate experiences. So, always make safety your absolute priority. The good news is that there are so many effective ways to practice safe sex. The world of condoms alone offers an incredible variety, different sizes, thicknesses, textures, and materials. It's worth experimenting to find the type that feels best for you and your partner. Involve your partner in the selection process. It can even be a fun bonding experience. But please, always be safe. Now, in terms of staying in control, I want to address the potential for serious physical injury, specifically penile fractures. A penile fracture is a surgical emergency. It occurs when an erect penis is subjected to a sudden, forceful bend, often during very vigorous sexual activity. This can happen if you accidentally miss the vaginal opening and forcefully hit a bony structure like the pubic bone, or if there's an awkward angle or sudden movement. When a penile fracture occurs, you typically hear a distinct popping sound, experience immediate and intense pain, and your penis will likely become very swollen and bruised, often described as an eggplant penis, due to its discolored and distended appearance. What's actually happening is a tear in the tunica albuginea, the tough outer lining of the erectile tissue, corpora cavernosa. This tear must be repaired surgically. If you try to tough it out at home, approximately half of men who experience a penile fracture and don't seek immediate surgical repair will go on to develop erectile dysfunction. It is far, far better to go to the emergency room immediately and have this surgically repaired. This gives you the best chance of maintaining normal erectile function long term. So, please, maintain control during sex. Ideally, gently hold onto your partner's hips to help guide movements, control the speed, and manage the angle, minimizing the risk of such a traumatic accident. Another crucial component of staying safe and preventing injury is lubrication. I cannot emphasize enough how important it is to be well lubricated during sexual activity. And guys, let's reframe this. Lube isn't a sign of a problem. It's fun. It makes things smoother, more comfortable, and ultimately more enjoyable for everyone involved. You should never feel that there's something wrong with your partner if there isn't enough natural lubrication. This is a very normal part of life and aging. Women often experience decreased natural lubrication as they go through perimenopause and menopause. Younger women can also have less lubrication due to certain medications, genetics, or a variety of other factors. It absolutely does not mean they are not aroused or not enjoying themselves. Embrace lubrication. It's a simple, effective tool for safer and more pleasurable sex. And if you're looking to enhance your intimacy and connection with a partner, remember that understanding and communication are key. For more insights on building deep connections, be sure to visit Dating Older Women. 6. Don't make it hot. Your testicles, that is. Number 6 addresses a common oversight. Don't make it hot. And by it, I'm referring specifically to your testicles. There's a fundamental biological reason why testicles hang outside the male body, unlike women's ovaries, which are internal. They require a very precise, slightly cooler temperature to optimally produce healthy sperm. Exposing your testicles to excessive wet heat can significantly impact your body's ability to produce viable sperm, potentially leading to infertility. It can also, to some extent, affect your testosterone levels. Therefore, I strongly advise limiting your exposure to environments that generate a lot of wet heat, such as jacuzzis, steam rooms, or very hot baths. Enjoy them in moderation, but don't make them a daily ritual. Furthermore, be mindful of everyday heat sources. When you're sitting with a laptop, try to place a pillow or a protective barrier between your genitals and the device. Similarly, it's generally better to keep your cell phone in your back pocket rather than your front pocket. All these electronic devices emit heat, and chronic exposure, even if subtle, can negatively affect your testicular health and sperm production. Prioritize coolness for optimal function. 7. Be nice to it, your penis. The 7th point is about mindful self-pleasure. Be nice to it. What exactly do I mean by be nice to it? I'm referring to the way you masturbate. Avoid overly aggressive techniques, such as what's commonly known as death grip. This term describes masturbating with an extremely strong, unyielding grip. The problem with such aggressive methods is that the intensity and pressure you generate with your hand are simply not something that can be replicated by a vagina, a mouth, or even another anal orifice during partnered sex. Your body, specifically your penis, can become habituated to that extreme level of pressure and intensity. Consequently, you might find yourself struggling to get aroused or maintain an erection during partnered intimacy, because the sensation is so drastically different, and your body is now accustomed to a much higher, unrealistic level of stimulation. So when I say be nice to it, I mean try to masturbate in ways that are more closely aligned with the sensations and stimulation you would experience with a partner. Use lubricant. Focus on pleasure and connection, not just rapid release. Masturbation should be an enjoyable, healthy exploration of your body, not a quick, shameful, hiding in the corner type of experience. Treat your penis with the respect and gentleness it deserves. 8. Don't smoke and take care of your overall health. Number 8 is a fundamental cornerstone of not just penile health, but overall vitality. Don't smoke, and unequivocally, take care of your general health. Guys, let's be absolutely blunt. Smoking will kill your erections. Period. There's a 100% correlation between smoking and erectile dysfunction. The chemicals in cigarettes severely damage your blood vessels, constricting them and impeding the crucial blood flow needed for a firm erection. If you smoke, quitting is one of the single most impactful things you can do for your penile health. Beyond ED, smoking is a leading cause of bladder cancer. I see the devastating effects of bladder cancer regularly in my practice. It's one of the worst cancers because it often requires frequent, invasive inspections of the bladder with cameras. And if surgery is needed, these are often major, life-altering procedures. Your overall lifestyle matters immensely. While it might not be as sexy, quick, or easy as a miracle pill, a healthy lifestyle is absolutely vital for your penile health. Remember what I mentioned in point number 1. 14% of men with ED will experience a heart attack within 7 years. This isn't just a random statistic. It highlights that ED is a direct measure of your blood flow, a biomarker of your systemic health. If you maintain a healthy body, your erections will naturally remain healthy. This means eat a healthy, balanced diet. Focus on whole foods, fruits, vegetables, lean proteins, and healthy fats. Minimize processed foods, excessive sugar, and unhealthy fats. Avoid smoking or excessive use of any other drugs. This includes recreational drugs and excessive alcohol intake. Exercise regularly. Combine aerobic exercise like running, swimming, cycling for excellent blood flow with resistance training, weightlifting, bodyweight exercises for boosting testosterone levels. Both are incredibly important. If you don't know where to start, begin with something so simple you can't ignore it. A 10-minute walk daily, for instance. Minimize stress. We often don't talk about this enough, but chronic stress takes a massive toll on your entire body, including your sex drive and your ability to achieve and maintain erections. While a little stress can be motivating, chronic, unmanaged stress is detrimental. If you find yourself constantly stressed, it's crucial to investigate ways to reduce it. This might involve mindfulness, meditation, therapy, spending time in nature, or setting healthier boundaries in your life. Taking control of your stress is a powerful step towards improving your overall quality of life and sexual health. For more insights on how a healthy lifestyle can positively impact your relationships and confidence, check out our resources at Dating Older Women. 9. Be nice to yourself. Point number 9 is deeply psychological, but profoundly physical in its impact. Be nice to yourself. I've observed countless times that when men encounter problems with their penis, whether it's related to appearance, performance, or function, they are incredibly hard on themselves. This self-criticism often escalates into immense stress and anxiety surrounding the very act of intimacy with a partner. This stress then becomes a self-amplifying, vicious cycle. For example, let's say you experience an instance of erectile difficulty in the bedroom one time. The next time you attempt to have sex, that negative experience is replaying in your mind, creating anticipatory stress and anxiety. That stress, in turn, makes it even harder for you to get an erection, so you don't get one. This failure then amplifies the stress, reinforcing the negative cycle. So please, be kind to yourself. Understand that everyone, every single man, experiences fluctuations in the function of their penis. There will be times when it simply won't work perfectly, and that is perfectly okay. A single instance, or even a few instances, does not mean your life is over, or that your sexual function is permanently damaged. It will often come back. What you absolutely must not do is engage in self-blame, treat yourself badly, or allow yourself to spiral into this horrible state of stress and shame. One of the biggest issues is that men rarely talk about this. They don't share their stress, their anxieties, or their experiences with anyone, which only makes the problem worse. Opening up, even to a trusted friend or a professional, can be incredibly therapeutic and help break this isolating cycle of stress. Remember, self-compassion is a powerful tool for resilience, both emotionally and physically. 10. Use it or lose it. And finally, we arrive at number 10, the point that often surprises men the most, yet holds significant truth. Use it or lose it. Is there any truth to this famous adage when it comes to your penis? Well, sort of. And here's why. Firstly, sometimes men stop using it because they are no longer consistently getting erections. This might be due to issues with their partner, embarrassment, stress, or even their partner's own decreased desire for sex. The real problem arises if they are not only struggling with erections during partnered sex, but also losing their nocturnal erections. Normally, during the night, men experience 3 to 5 involuntary erections. These nocturnal erections are your body's natural way of exercising your penis, ensuring it receives a healthy supply of oxygenated blood flow. This regular oxygenation is crucial for maintaining the health and elasticity of the penile tissues. When these nighttime erections cease or become infrequent, you might start noticing subtle changes. Your penis might seem to get a little shorter, or the tissue might feel subtly different, perhaps due to the formation of some scar tissue. So yes, if you don't continue to have regular erections, particularly the protective ones at nighttime, this could indeed be a sign of actual penile shrinkage or changes in tissue quality. Secondly, this principle also applies to your sex drive. If you have a low sex drive, which can be related to chronic stress, hormonal imbalances, certain medications, or a variety of other factors, and you consistently avoid sex for an extended period, your body can effectively recalibrate. It might start to realize that this function isn't being utilized or needed anymore, and consequently, your sex drive can continue to decrease. You've essentially allowed yourself to lose the urge. While for some individuals, a decreased sex drive might not be a problem, it can certainly become an issue if you're in a relationship and your partner desires intimacy. I firmly believe there are immense benefits to consistent intimacy and sexual activity with a partner, regardless of your age or what stage of life you're in. It's not just about the physical act, it's about connection, bonding, emotional closeness, and stress relief. It requires effort from both partners. Not everyone wants to have sex all the time, and that's perfectly normal. But the value in maintaining intimacy, in all its forms, is profound. It strengthens relationships, boosts mood, and contributes significantly to overall well-being. So, make the effort to prioritize it. And before you zip up your learning and walk away from this incredibly important discussion, remember this. Wise men don't just protect what matters. They learn how to sharpen it, how to optimize it, how to ensure it serves them well throughout their lives. This includes your most intimate health. If you found immense value in these insights, and you're committed to protecting and enhancing your health, your confidence, and your ability to connect deeply, I urge you to take the next step. 1. Subscribe to the Dating Older Women channel right now. We delve into topics just like this one, empowering you with knowledge for a more confident and fulfilling life. 2. Hit that like button if you learned something new today and want to see more content that truly matters. 3. Share this video with a friend or someone you care about. You might just be saving them from making one of these critical mistakes. 4. Leave a comment below, sharing your biggest takeaway or any questions you have. I love hearing from you and engaging in meaningful discussions. 5. And for exclusive content and deeper dives into building incredible relationships and boosting your self-assurance, make sure to visit our website at datingolderwomen.com. Your journey to a sharper, healthier, and more connected you starts now. Don't miss out.